All right. Hi. We would like to thank everyone for attending today's webinar titled Oral Health Messaging, How Policy Communications Can Advance School Oral Health. During today's presentation, we learned tools around oral health inequity and strategies for how to talk to policymakers most effectively. But before we begin, we have a few housekeeping reminders. Help us count. First, please help us with our attendance count. If you are viewing as a group, please go to the chat window in the chat icon and type in the name of the person registered and the total number of additional people in the room. For example, Jenny Jones +3. This will help us with our final attendance count. Also, all attendees are in listen-only mode. However, we want to hear your questions. To ask a question at any point during the webinar, please use the Q&A icon located in your Zoom toolbar either at the top or bottom of your screen. We will address questions following the presentation. At the end of this webinar, attendees will be asked to complete an evaluation poll question. Please let us know how we are doing. Your feedback is vital in helping us craft presentations that meet your needs. This webinar is being recorded and will be archived on our website in 3 to 5 business days. Please also visit School-Based Health Alliance for additional archived webinars for topics such as this one you are viewing on your screen. Alliance works to improve the health of children and youth by advancing and advocating for school-based health care. When health and education come together, great things happen. Attendance improves. Conditions like asthma or diabetes are better managed. Behavioral health issues get quick expert attention. And we all know that healthy students make better learners. Now I would like to introduce our presenters for today. Katie Leonard, Communications Manager for the DentalQuest Foundation. Katie began working for the DentalQuest Foundation in 2014. As Communications Manager, Katie's job is to manage communications to both internal and external audiences, highlighting the impact of the Foundation's grantees and working to engage new partners, all of whom are working collaboratively with the Foundation to advance the mission of improving oral health for all. Matt Jacob, Director of Communications and Outreach for the Children's Dental Health Project. Matt Jacob manages CDHP's communications. He has led efforts to secure media coverage about CDHP's priorities, including stories that have been published or aired by New York Times, CNN, Fox News, Atlanta Journal-Constitution, National Public Radio, and the Huffington Post. He also advises federal and state health officials on communication strategies to strengthen oral health. For more than 20 years, Matt Jacob has helped nonprofits and advocates for issues, particularly in the areas of children's health and education. And without further ado, we'll have our first presenter, Katie Leonard.
Thank you so much, and hi everyone. The time today to learn a little bit about Oral Health 2020 and our project with the Frameworks Institute to rally oral health stakeholders around some reframing strategies that will help to move the mission of Oral Health 2020 forward. This has been a big focus of the foundations and for our network over the past couple of years, so much so that our recent annual convening, which some of you on the phone were at, it was really the focus of that meeting and will be a theme that we will prioritize in the next coming years. So next slide, please. So just a quick overview of what my piece of the presentation will cover. I'll give an intro to the work of Frameworks Institute, which has been our partner in this project, and a little bit of intro on the differences between framing and strategic communications, and just go over the high-level findings that the Frameworks Institute, their research has resulted in when it comes to how the public thinks and feels about oral health. And then we'll also do a high-level overview of their recommendations for how we as advocates begin and continue to talk about oral health in ways that will move policy forward and improve the public's perception of oral health as being valuable to overall health. And then I'll just go over some next steps for staying involved in that work and some resources to help you and your partners understand the work and helping it to move forward. And just a little disclaimer is that this is 15 or 20 minutes of a project that's been going on for the past couple of years. And the research is pretty dense and the findings are robust and complex. And this is a really high level of our project with Frameworks Institute, and I'll go over some of the opportunities that we have to engage with the Frameworks team in order to get some more technical assistance and understanding of the project moving forward. Next slide, please. So the Frameworks Institute, they are a communications research firm based in Washington, D.C., and they specialize in working with advocacy networks who are looking to move a social issue or reframing a problem of a social issue. That some of the issues that they've worked on previously have been elder abuse, climate change, addiction, childhood trauma and stress. And their focus is really changing the context of an issue in order to change public thinking, so that change in public thinking then results in changing knowledge about the issue, changing attitudes, and ultimately driving policy change and support for social issues. And so while communications can do a lot of things, the frame, can change behaviors, can change salience on an issue. What the Frameworks Institute really focuses on is changing the context of it in order to move policies forward. Next slide, please. So their mission is on this slide here, and the mission is to advance the nonprofit sector's communications capacity by identifying, translating, and modeling relevant scholarly research to frame the public discourse on social problems. And so back in 2015, our project with Frameworks began, and this rose out of the fact that one of the goals of Oral Health 2020 is, in fact, to change the public's perception, to improve the public's perception of oral health to overall health in order to improve well-being for all. And so we partnered with the Frameworks Institute back in 2015, and this has been really one of the focuses of the foundation's funding in this goal area. In addition to that, we're also doing work with Harder & Company to do some media and social media evaluation about how the public thinks and talks about oral health, who's talking about it, who are influencers in this space. And in addition to that, we're also funding a grassroots engagement strategy, which really focuses on incorporating community members and their voice into the public discourse on oral health. And so involving those that are directly impacted or most impacted by oral health disparities in the conversation. And the Frameworks Institute, the work with them has been a major piece of that funding towards that goal as well. Next slide, please. So what is framing? Frames are sets of choices about how information is presented. So what to emphasize and how to explain it, and what to leave unsaid. So strategic framing really works a little bit differently than other strategic communication strategies in that frames are meant to be employed via strategic communications. And so the frame around an issue really shifts those kind of internal cultural models that we hold in our brain, those kind of mental shortcuts that our culture, our experiences, our lives have kind of ingrained in our mind, so that, which really, these cultural models really form our insights and perceptions and assumptions on things. And so what the Frameworks Institute does is really look at what are those mental models that people have around a social issue. And then once they've figured that out, what are the ways that we can talk about that issue in a slightly different way in order to shift people's perception of that issue? Next slide. And this slide here really dives into a little bit deeper of what the differences between framing and strategic communications are. So framing drives the public narrative in a new direction. So again, trying to change that public discourse of a wide breadth of people in the general public, what they're thinking, while strategic communications really drives action towards a specific measurable goal. Framing changes or establishes contours, terms, and context of an issue. Strategic communication often works within the current discourse, which is of course a consideration as well when using reframing. Having an understanding of that current discourse is of course ultimately important as well. Framing is really a long-term thing. It's needing to be consistent use of a new frame over time around a social issue in order to achieve long-term goals. And that is the frames that are established, which I'll talk a little bit later about, ultimately in oral health, what we'd like to use is the frames around oral health. While the messaging itself may change, the vehicle may change, the audience may be different, that frame is consistent in each of those audiences. And the way that we employ that frame may change, but that frame is consistent across whoever we're talking to, whether it's policymakers or coalition members, the general public, communities at large. That frame is consistent over a long period of time in order to make that shift. For framing communications, the tools really are values and metaphors and themes, whereas in strategic communications, we have a message, a tweet or a press release, a call to action, a little bit different. And again, the framing coordinates positioning across the field, and often strategic communications follow the calendar with a set goal and a communications plan behind it to reach an ultimate measurable goal. Next slide, please. So this slide here outlines the research process that the Frameworks Institute follows, and the one that they followed for this project in particular. So the first step in this process, and again, we started back in 2015, so coming up on 2 years that we've been working with them. The first step is an expert interview process. So for the Frameworks research team spoke with experts in the field in oral health to get a sense of what do experts know to be true about oral health, and kind of get a baseline there, because the next step is talking to the public about what the public views oral health as. So that was done by a series of on-the-street interviews and in-person surveys, online surveys. And I'll talk in a future slide about kind of what the gaps were in between what experts know to be true and what the public thinks and feels about oral health. And that's really where the starting point is in order to understand how we can shift the public's mental model to one that ultimately advances oral health policy. The next piece of their research was looking at how the media is talking about oral health and doing a field frame analysis. So comparing how media is talking about oral health compared to how advocates talk about oral health. And there's a great piece of work that I'll link to at the end of this presentation, which actually examines, it's a separate report, which examines that in more detail. And the high-level finding of that is that advocates are actually doing a really great job of speaking about oral health in a way that is beyond teeth and beyond the dentist, and really highlights more of the systemic issues that impact oral health, whereas media is not paying as much attention as we'd like them to. And then the second half of the research process is really starting to design tools. What reframes, given what we know, how the public is feeling, and what experts know to be true, what reframes could be possible and plausible? What might work best? Their on-the-street interviews and their controlled experiments really showed which reframes will really perform the best here. Of the number of options that they came up with, which ones are apt to be more successful, and we'll highlight those at the end of the presentation. And then lastly, how does this actually look in the world? Are people, when given this frame, are people able to apply it and understand it? Next slide. So this is a excerpt, a tiny little excerpt from that Map the Gaps piece, which was looking at what experts think and how the public feels. So experts know that oral health is a system. It is not just your teeth, not just about cavities and brushing and flossing, but in fact is impactful on your overall health. And experts know that there is a system at play that's not just the dentist's office, but it involves policy as well. There are issues of access. People are not, the public in general thinks of oral health as teeth, and that a problem with oral health is that you have cavities, and if you don't, then you have good oral health. And there's a lot of focus on the individual, so that if you have bad oral health, it's your fault. And if your kids have bad oral health, that's your fault as well. So not really thinking of the systemic issues that impact oral health, like access to coverage or cultural competency, being able to see a dentist in the language that you speak, or being nearby a provider that can take your visit and see you. So there are a bunch of other ones which are included in our message memo, which I also linked to at the end of the presentation, but these are just some examples which kind of highlight the findings. In terms of what threatens oral health, experts know that your environment, again, those issues, there are barriers that exist to people getting care. Again, the public kind of thinks of it as an individual thing. If you brush and floss and go to the dentist, you'll be all set. And there's no, if you have bad oral health, it's because you don't care. So that's really different than the position that the Oral Health 2020 Network and other stakeholders are taking when it comes to tackling oral health. The experts know that public health initiatives can help eradicate bad oral health. The solution is more fatalistic when in the public's thinking that brush, floss, and go to the dentist, you should be all set. If you're not able to do that, the solution is really a $3 toothbrush. If you can't do that, then that's your problem. So really different thinking than what advocates know to be true. Next slide, please. So what Frameworks did is they view this as all of these mental models that the public thinks and feels are contributing to kind of this swamp of oral health. So it's messaging that advocates need to kind of wade through, and there's many different layers of this swamp, and there's a lot of different networks. But these are kind of the things that we as advocates need to wade through in order to get people really on board with supporting oral health policy change. So they are, again, on the left-hand side, and good or bad oral health is because you've either taken care of your teeth or you've chosen not to. The connection between oral health and overall health is one that's not really understood. People know that there's a connection, but what is that exactly? Again, in the middle of the top of the slide, good oral health means you don't have any cavities, and those are pretty white, straight teeth and fresh breath. People kind of get that the mouth is the gateway to the body, but again, they don't understand how and why. On the right, problems of bad oral health are that you just have bad eating habits or bad personal habits. You're not taking care of your hygiene needs, or again, you're choosing to not get care when in fact we know that that's not the case for a lot of people. A lot of people do understand that it's important and are unable to get care for a number of reasons. Next slide, please. So given all that's in the swamp of oral health, how in that gap between what experts know to be true and what the public thinks, over the course of their research, Frameworks has come up with this list here on what to avoid when talking about oral health and what to advance. And so here's where I'm going to stop and give a plug for Frameworks message memo, which again, I linked to at the end of this slide, and we'll make sure that all attendees have access to it, but I highly, strongly cannot urge you enough to read it in full, because it really goes into detail into each of these findings and ways that advocates can really employ these strategies in order to advance oral health. So on the left-hand side, avoiding framing that narrows the scope of the issue to the teeth. So this got a lot of attention, this particular one. So many of our communications focus on just the mouth, just a smile, or just, kind of a happy, cartoonish looking tooth. So Frameworks is actually advocating that we don't limit images or text to just the teeth. That oral health is so much more. And instead, we should advance images and explanations that connect oral health to overall health. We need to avoid talking about disparities in a way that doesn't talk about the solutions for them. And so when we talk about maybe a group that statistically has worse oral health than another group, if we're not talking about the solution to that or ways to address a solution that really addresses people's specific needs, so using the value on the right-hand side of targeted justice to really tell a better, fuller story about promoting equitable access to quality care. That way we're not emphasizing that value of the individual or, you know, a problem of culture that people don't take care of their teeth. Instead, the targeted justice, which the message memo again goes into much more detail about what that means and how that can work as a value in communication. So again, please, please, please check out the message memo. Again, quickly on the left-hand side, avoiding leaving prevention undefined, undescribed, or individualized. So not just talking about that solution of just brushing and flossing, but making an economic case for public prevention, public health strategies that are widespread across all Americans rather than just one group over another. But again, understanding that there are different solutions for different groups and that there's no one size fits all. This is another one, avoid zooming in on individual cases to illustrate systemic problems. Telling the story of an individual in so many of our communications is so impactful. Everybody knows the story of Diamante Driver. Every time we talk about frameworks, that story comes up because it really resonates the tragedy of oral health in some cases and really the dire circumstances. But we need to be able to make sure that when we're telling individual stories that we really talk about the systemic problems that might have impacted an individual's story. So instead, we talk about using the metaphor of using locked doors and keys, so that oral health is, to get good oral health, we go through a series of doors. Some people come to locked doors. Some people have the keys to those doors and others don't. And in the next slide, I'll talk a little bit more about that metaphor and how we use it. And lastly, avoid leaving solutions to the public's imagination. So being specific about what you as an advocate are doing to address the disparity that maybe you're communicating about. And instead advancing the idea that oral health involves teams of professionals working across the community and impacting a system rather than just leaving that kind of system undefined. Next slide. So this is one of the examples that's also in the message memo, and this is a strategy that Frameworks is recommending for how we might talk about oral health in a way that shifts people's perception away from the individual and away from just brushing and flossing as the solution, and helps people to see really beyond that and see the systemic influences that are at play. So again, whether it's language barriers or insurance coverage or access to a provider. An example of using this is that to get good oral health, everyone goes through a series of doors, but for some people, they are locked. We should make sure everyone has keys. And so when Frameworks actually tested this metaphor, it worked to get people to think outside of just seeing the dentist twice a year for cleanings and brushing and flossing in the meantime. It really got people who had previously not thought about insurance coverage and policies that impact insurance coverage and cultural competency. It got people to realize that those are important pieces in telling the access to oral health story. Next slide. So again, this is just, I've taken, I think, about 20 minutes to present 2 years of work. So it's I really want this to be a high-level overview of the work that we've done. And I would urge you to please get in touch with me and look on Socius for the resources and visit the Frameworks website for the full report of all this information. There's a lot of good information on there. So I'm linking to both of the resources that I mentioned. The first is Unlocking the Door to New Thinking, Frames for Advancing Oral Health. That's the message memo that details both the research, what to avoid in advance, and ways that these reframes work and how to start using those. Getting stories to stick is that media content and field frame analysis, which looks at how media versus advocates are using and talking about oral health. We have a toolkit that's coming out in December, which will really help start to employ these strategies. And we started at our national convening, we've really started to host trainings and other technical assistance for members of our network and others. And that will continue in 2018. And so urge you to keep in touch with SOCIUS and keep in touch with us for the opportunities that you can use to both get one-on-one assistance for your own materials and to attend some trainings on how to really get a deeper understanding of the project. And lastly, our National Oral Health Connection team, the Communications and Messaging Work Group, has a sub-work group that's working in line with frameworks in order to develop the strategy for the next coming years going forward and make sure that we're meeting the network's needs when it comes to understanding this work. So would urge you to connect with that group as well on SOCIUS. And that is it for me. And I will turn it over. My contact information is here. And feel free to shoot me an email or send me a message on SOCIUS. We're also on Twitter and Facebook, so give us a like and a retweet every now and then. Follow us on Twitter. And the last link for anyone who's not already a SOCIUS member, that's the link to our collaborative platform that connects the Foundation's grantees and the Oral Health 2020 network at large. So please sign up for that if you have not already.
Thank you, Katie, for that, for strategies on framing versus strategic communications. Now I'll pass it over to Matt Jacob.
Thank you very much, Nataki, and thank you, Katie, for laying a nice foundation with the overview of the important work that Frameworks Institute provided. So next slide, please. So we talk a lot about framing issues, and it's really important to think about frames, especially when you've got prolonged communications over a period of months or years that you're going to be delivering to your local community, to a broad group of grass tops and grassroots members. We took sort of a slightly different approach. We are the Children's Dental Health Project, and we focused on trying to test the messages with an eye toward policymakers and influencers. And when I say influencers, I'm essentially talking about the people who are sitting kind of in a special place in terms of their ability to influence the decisions that policymakers might make. So these are people who have periodic interaction with a state legislator or school board members or other officials, local, state, or national, who are used to, sending letters and providing testimony, perhaps on a particular bill or proposal that might come up, interacting with state Department of Health officials and others as they develop policies that pertain to healthcare in general, or in this case, to oral health. So we wanted to identify messages that could help move us from a system that is focused primarily on treatment, dealing with oral health issues downstream, to one that can prevent and manage dental disease. And so we also wanted to try and think of messages that would engage a broader group of stakeholders, so that there are children's advocates and others who understand why they have an interest in being part of this effort to help move us to a much better place, a place that is not this kind of separated, bifurcated system set off by itself. Next slide, please. Just quick circle back here to let you know a little bit about us. Some of you know about the Children's Dental Health Project. For those who don't, we were founded by a pediatric dentist, Dr. Burton Edelstein. We're celebrating our 20th anniversary actually this month. And this is a pretty good overview of our mission. We're really looking to advance innovative, cost-effective policy solutions so that no child. We also do a lot of work around the oral health of pregnant women. Next slide, please. So this was really, these were the two questions that guided this project. What do policymakers know about oral health already? And then what facts or messages, if we work those into the dialogue and we present them with those facts and messages, which ones are most likely to strengthen their support for greater investment in oral health? What is it that helps put oral health on their radar screen? You know, we're constantly, so many of us are putting together fact sheets and one-pagers and handouts, trying to think of the stats and facts that we think are going to grab people's attention. And this was an interesting exercise because there were some things that we have talked about that definitely did resonate. And there are other statements that, and I want to be quite honest here, that we've used, that many of you have used, that kind of fell flat. They didn't really seem to work as well. They didn't somehow make people understand that oral health really matters. Next slide, please. So we commissioned a public affairs firm in the Washington, D.C. area that has a substantial health policy experience to conduct two types of qualitative research. So not quantitative, but qualitative. So they weren't sort of doing a survey and asking people yes, no, you know, rate something from 1 to 5, that kind of thing. These were in-depth interviews conducted by phone with these key policymakers and influencers. And then there was a focus group that followed that. So there could be prolonged discussion, and also so different people could kind of react to and build off of what somebody else had just said. So we kind of did something that was very focused and individualized, and then we did a broader focus group. And so we really wanted to just understand where those knowledge gaps might exist and how to sort of combat them. Next slide, please. So a whole variety of people were in the mix. They included pediatricians. We had a children's hospital administrator, a former state secretary of health in a state in the southwestern part of the nation was one of our participants. There was somebody who was both a family physician and a state legislator was in the mix. We had a child's advocate in the Mountain States, an insurance executive in the Mid-Atlantic, a health policy analyst in New England. So I just want to give you the sense, you know, a lot of diversity, both regionally and diversity in terms of the hats that people wear. But all of these people are either developing or shaping public policy. All the people who were involved here are people who definitely have been in the mix. Next slide, please. So we provided them with a list of 7 facts or stats about the impact of poor oral health. They were asked to choose which ones they felt would resonate most with policymakers. In the cases of policymakers, it was really which stand out to them, which, you know, are things that they think would help them make the case internally at their agency or maybe at the legislature to take some action. Next slide, please. So I think, you know, a green light versus a red light is maybe a good way to sort of think of this. And so these are really the green light messages. These are messages that, at least based on our national qualitative research, we would recommend that people make it a point to use, to really work these into your letters, your talking points, your elevator speeches, all of the things that you do, your blogs, social media, etc. These were definitely rated as most persuasive by people. So, and if you really see the commonality here, whether it's the cost and just the, you know, the trauma of thousands of kids being treated for tooth decay in hospital operating rooms, that was data from Colorado. There is a national, there's a study that is the source of the point that many of you are familiar with, that children with poor oral health are nearly 3 times more likely to miss school. That was a North Carolina-based study. So the thing you see in common here is we're talking about impact here, right? So this is the impact of not preventing tooth decay, of not managing the early signs of decay and preventing them from advancing to a full-blown cavity. Or in many cases, we're talking about children, sadly, who had rampant tooth decay, numerous cavities throughout their mouth. So next slide, please. So the facts that were least persuasive, well, one of them was 1 in 4 kids entering kindergarten already has had at least one cavity. Or sometimes the stat is used as 1 in 4 children entering kindergarten already has cavity experience. The second stat was, you know, that children who have tooth decay in their primary teeth, they're more likely to develop it in their permanent teeth, their adult teeth. And also another one that didn't really hit on all cylinders was a statistic that so many of us use, which is that tooth decay is the single most common chronic disease for children and teens. That one was not one of the least persuasive, but we were a little surprised that it wasn't one of the most persuasive. And again, I think the thing that we came away with was it doesn't really speak to impact. It's a statistic, and it might catch somebody by surprise, but it doesn't really say, so what is the impact of not preventing tooth decay? What's happening? And where are we seeing that impact? So next slide, please. And so I want to just shout out 4 key findings. The first one, and I kind of jumped to the message testing piece, but to circle back to the first goal of this project was, what do they know? Well, a little, but not a lot. We find that many policymakers do not understand that tooth decay is actually a disease process. That's kind of first and foremost. And so the idea of disease management, something that the healthcare system talks about a lot when it comes to children or teens or adults with diabetes. We hear about that a lot, about self-management, disease management. That term really doesn't have a lot of relevance to people, in part because the very basis of it, that caries is a disease, is something that a lot of people just don't realize. So that concept, to get it to really take hold, we're going to have to really more clearly define and, first of all, educate about the fact that we're talking about a disease, but also trying to find some more concrete ways of connecting this with something like diabetes and helping people understand that the same things are at play, that you just don't wait until a child has a bombed out mouth, that there are steps that can be taken with the children, with their parents or caregivers, et cetera. Next slide, please. The third key finding was that people were really unaware of the human and financial costs that dental disease has. Now, we focused on children, but of course, those of you who are working a lot on adult issues, you know very well that ER visits among adults are certainly very costly as well. There's a lot of that going on because Medicaid really in many states does not provide very robust coverage, to say the least, in terms of what will be paid for. So there's a struggle, there are access issues, but just on the children's front, I mean, it was interesting that people were quite surprised. Even people who had sort of had some skin in the game and had some familiarity with oral health issues and talked about them within their states. Some of these stats that we shared were definitely kind of eye-popping to them. So again, I think what we sort of took away from this was messages that focus on decay's prevalence didn't resonate nearly as well as messages about decay's impact. How is it impacting kids and families? And then I think fourth, last but not least, it's important, Katie talks so well about the importance of a team, right? That this isn't just some individual thing that a child or an adult, sort of has to do X, Y, and Z, and everything will be great inside their mouth. But that we help people understand that we're talking about, just as we have a healthcare system, there's a dental system, there's a dental care system, and there are many dynamics as part of that system that individuals don't control. And so we also want to broaden it out. I'm speaking more of CDHP here, to helping people understand that there are a variety of people that can have a really important role to play in oral health. And we don't want people to just think of this as, oh, it's, a dentist. You go to the dentist and you brush your teeth, right? That was kind of the point that Katie made. I thought that really stands out from the framework's research, that it's kind of all about seeing dentists, once or twice a year, and then you brush your teeth regularly and don't eat very bad food, right? And that's going to kind of keep you healthy. And that we want people to understand there are a lot of people beyond dentists who can play important roles, like pediatricians, like community health workers, like school nurses, and just, a variety of important people. It may not be their focus, but, it should be part of their game plan. And we want the oral health community to really reach out and encourage that kind of collaboration. Next slide, please. Here were just some sample comments. I wanted to share these from some of the people who were in our focus groups and IDIs. These were actually taken from the focus groups. Again, you see, just the the knowledge gaps were pretty apparent. I love the quote on the lower part of the screen. If tooth decay were treated like every other disease, wow, it means all of us have a role to play, right? So, very, very important. Next slide, please. A couple more comments to share. There were some people who definitely understood, managing caries in the way we manage other disease makes sense. This approach is the only way we're ever going to make any substantial headway and stop trying to drill and fill our way out of the problem. There was another quote below about, not just that it's not just about healthcare costs, but it's a broader cost to society. And the next slide, please. Last but not least, I think this is more of a tactical recommendation, right? It's sort of, it's really going to take a lot of people to kind of steer Medicaid policy and the oral health system to really incentivizing prevention and really getting children assessed at an early age. What is their caries risk and what can we do? How can we align services to make sure those kids stay healthy? Next slide, please. So this is my name, that's my title, this is my story, and I'm sticking to it. So it's been a pleasure to share this information with you, and I hope it was helpful. That's my contact information, and please follow us on Facebook and Twitter, and I'm ready for any questions or comments.
Well, thank you, Matt, for a look at how our policymakers view the issue of oral health and some tools and tips on how to get them engaged better in the field. So before we go on to questions, we have a few announcements for you all. Donna, if you'd like to take it away.
Sure. Hi, everybody. Thank you all for participating in the webinar. I'm Donna Behrens. I'm at the School-Based Health Alliance, and I direct our school oral health initiative. I want to thank both Katie and Matt for their excellent presentations and for getting us thinking and talking about how we talk about oral health needs of our kids. And I really encourage people to go to CDHP and go to the resources that Katie put the links to on her webinar slides. The information is really excellent, and again, I know that the Frameworks Institute just released all of this information. There's so much to digest, and CDHP has been in the trenches working in this area forever. So I hope everyone takes advantage of their resources, and we look forward to the toolkit that's going to be coming out. So in the meantime, and while you're typing in, we do have a few questions that have come in already. Who and what is School-Based Health Alliance? We are a membership organization. We welcome your membership. We are about school-based healthcare, and oral health is very much a piece of that. Next slide. We also are in the middle of a very important triannual census of school-based healthcare. Anyone who has data that they want to report as part of our census, we encourage you to go to the 2016-17 census website and submit your data, stand up and be counted. We also are going to be holding our annual school-based healthcare convention, which has a very robust oral health category, along with many other important school health topics that will be a part of our convention. So please join us. It will be in Indianapolis, Indiana this year, and it will be from June 24th to June 27th. The call for abstracts is closed, unfortunately, but we know that we've gotten already an overwhelming number of great abstracts. So put it on your calendar, plan on joining us, and I am going to move on to some of the questions for our panelists. We had from Julius Lee to our panelists, the question is, what about environmental factors? Can these attribute to tooth decay? And how do we address these factors to policy makers? So why don't do you want to start on that, Matt, and then we'll turn it over to Kate?
Yeah, that's a real simple question, right?
Yeah, just little.
Yeah, social determinants, they are very important, and we can't lose sight of them. And so, I think we've got to tackle this head on. I don't have quick answers right off the top of my head, but I think it has to be part of the dialogue when it comes to conversations that all of us have with school board members, with other stakeholders, state Medicaid officials. We know that transportation can be quite a challenge for parents and families trying to get kids to care. That's part of the reason why school-based health services, make so much sense, because we know that's a place where kids in large numbers are found. Delivery becomes very cost-effective for that reason. But, I think trying to understand and build into our planning what's going on inside these homes and the challenges and traumas that families are facing. That has to be on the table if you're going to really plan a program and an approach and develop strategies that make sense. And those can vary significantly from one community to the next. They differ from low-income communities that have been here for many, many years as they would from low-income communities that are mostly immigrant communities. So the challenges have many different layers, and we've got to build that into the conversation and go beyond simply, okay, who gets reimbursed what for what service. We've got to think about the population at hand, the moms, the dads, the caregivers, the kids.
Great, thank you. And Katie, how about from the perspective of the work that you've been doing?
Yeah, so I would definitely echo Matt's statement that it's important to talk about these factors. That was one of the major findings of the framework's research, is that we need to talk about these environmental factors and these determinants of health that lie outside of just brushing and flossing and going to the dentist. And I think for policymakers, one important distinction that frameworks kind of makes is that so their focus of their work was really the general public. But the thinking behind that is that by shifting the public's perception of these, we're directly impacting, policymakers' constituents. So by making it more of an issue and changing the context of it for regular folks, the hope is that it will rise up in importance to what people are contacting their legislators about and demanding change for. And so that's really the perspective from the Frameworks Institute in their research. And the other thing too is that policymakers are also people, and there are a lot of we need to talk about these factors to that audience as well, obviously. And these one point that's come up in a lot of our discussions with the network is that policymakers have a million different issues that people are presenting them with on a day-to-day basis, and they can't possibly we know that we have legislative champions, but they can't possibly know all of the factors and the things that are important to us for the policies we're advocating for. Not everyone can be an expert. So it's the hope that by talking about it in the way that Frameworks and that CDHP is talking about it, that those communications are really incorporating those factors and helping to change the context for what policymakers think too.
Great, thank you. And we did have a question, and Katie, I think this goes back to some of your original slides where you were talking about the importance of framing. And a question was, am I right to think that our current president, again, not getting into right or left, but our current president's used framing masterfully in last year's campaign? And again, as we talk about the difference between a strategy and a frame, I assume it's just a question as to whether what your feeling was about that.
Yeah, I would agree. I think Lawrence sent that question in. Yeah, absolutely. I think the way that then candidate Trump framed different groups of people, different countries definitely were communicated in a way that framed people, or that kind of built on maybe some of the mental models that already existed for certain groups, whether supporters or not, whatever, we won't get into that. But, and I think kind of built on some feelings that people already had, and were able to frame and present people or issues in a way that played into what the public kind of already saw, or some members of the public kind of already had in their minds. And, you know, framed those groups or people or issues in a way that lent support to his campaign, I think. I don't know, that's really not artfully articulated, but yeah, no, I would agree for sure.
Yeah, I appreciate that's kind of a challenging question to thread a needle on without getting into the pros and cons of what the frame was, but a way to use a frame in a very masterful way. Certainly, I think we have all seen the results of that masterful way of framing. And certainly lessons to be learned as we want to frame oral health as something beyond individual responsibility for brushing and flossing. So much to be learned by thinking that question over. Thank you, Larry, for posing it. Are there, I'm not seeing any other questions coming in from our panelists.
We do have one more question from the chat. Q&A. It says, can frameworks create some graphics or infographics that reflect the concepts of oral health versus teeth? I've been trying to get rid of the extracted teeth logos for a long time. And this question comes from Bev Eisman from ASTDD.
Yeah, thanks, Bev. I saw your question come through, and I've been quickly trying to search my desktop for an example that Frameworks presented at our meeting in October, and it gets to exactly that question. And so the infographic that they developed as an example really shows the whole body instead of zooming in on the mouth, and highlights different parts of the body and the ways that oral health impacts that area. So I'll be sure to dig that out, and I can send it over to Donna and Nataki to forward that along as well. And that is kind of an example of one way to do it, but I think that could be helpful and address your question.
Yes, I was very taken, again, this is Donna, I was very taken at the presentation by Frameworks where they put the happy smiling tooth and all of the graphics that we tend to see quite frequently highlighted in our literature, in our one-pagers, in our brochures, with a big red band symbol over top of it. So it really, it took me aback, and I, again, you know, my encouragement is that people really dig into the Frameworks document. I think there's a lot to be learned. I know I learned quite a bit, including how people think of elderly, and there were many surprises. So, Nataki, have I missed any other questions, or do you think have we?
Nope, I think we have them all. And then, of course, if you have some lingering questions, feel free to email the presenters or us at the end, and we will make sure to get those questions answered for you. But before we hop off, we do have some questions for you all. We want to make sure our webinars are tailored to your needs, so you can help us fill out some brief evaluation questions for future webinars. So I'm going to go ahead and launch the poll, and you should be seeing on your screen. The first question is, did the webinar meet your expectations? Yes, somewhat, or no? How likely are you to apply information from the presentation in your organization? Not at all likely, unlikely, likely, extremely likely. How would you rate the presenters? Excellent, good, fair, or poor? And would you recommend this webinar to others? Not at all likely, unlikely, likely, or extremely likely. And I'll give everyone a few seconds to answer this.
As you're answering, again, I want to encourage you to utilize the School-Based Health Alliance website. We have resources on school oral health on our website to take a look at the SOCIUS, the Oral Health 2020 Network's communication platform, which has a schools page. You will find this webinar and many others recorded there, and lots of other resources and links. CDHP, which is a constant source of great information, especially around the policy issues swirling in healthcare and its impact on oral health. So we really appreciate everyone's participation today. Thank you for being engaged and a part of it. Again, if you have any other questions, please feel free to contact us either directly or through info@schoolbasedhealthforall.org. So thanks, everyone. Happy Monday. Enjoy your week. And we'll be looking forward to connecting in other ways at other times.
Thank you.